Hello, 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 parenting genie. You can see tonight I'm in the car. I need to catch a train, so I'm near the train station. And I'll give it another couple of minutes until I start. So hopefully you can hear me. You can always give me the thumbs up if you are out there. And I'll start in a minute. I even have a torch in my car so I can read a little bit of my notes. Got quite dark already. So it's Constance here, your lactation consultant presenting for Parenting Genie, our usual Wednesday night catch up. I am in Melbourne, Australia. I don't know where you are and where you're watching it from. And I've got some very, very exciting little snippets to share with you today because I have been doing an online international conference at the moment, like I'm an attendee. Last year I was presenting myself, but this year I'm just attending. And so the topic you have already seen is breast pain and nipple pain and burning sensations and those kind of things. So what the news is to many international board certified lactation consultants and healthcare practitioners and lactation care providers is latest research that has come out from Spain, but also in other countries. There have been some research done, and that is on the overdiagnosis and overtreatment of nipple thrush. And you may have had that experience yourself. So often, if you go to a lactation consultant or your GP or your provider, your healthcare provider, and you say, "Oh, I've got burning, itching, stinging nipples," and then they look at your nipples and there's dry and flaky skin, and you may even say there's deep breast pain after you've finished feeding. It really is like a cutting pain in the inner part of your breast. Then they usually say that is thrush. Now, you don't know what thrush is, or you do, but and also, please, you may feel a little bit confronted because you've been treated like that. And trust me, it's not going to change in 5 minutes, but I want to give you that option to see for yourself how this could be changed. Now, I've looked up guidelines already in the UK and England, and there's already a lot of changes happening on their guidelines. However, in Australia, most hospital guidelines have not changed just yet. So, what is thrush? Thrush is a yeast infection, and it's caused by a fungus called Candida. And most of us women may have had an experience with it because we can get it as a vaginal thrush infection, quite often also associated with hormonal contraception or with antibiotic treatment. And we can have candida. It's a normal part of a normal part of us having it in our body. But the problem is when it multiplies to a certain degree. So it thrives in warm, dark, and moist environment, and it is therefore able to multiply and cause that infection. And so you can imagine the nipples after feeding. We put breast pads on it, we put creams on it, that is moisture, and then we put our bra on and our clothes on, and then there's no air. And so, yeah, so that is a really good environment. Now, babies can also get thrush. And the interesting thing about what I'm telling you today and what I'm sharing with you, and like I said, it's all new to me as well, is that we always were told that we had to treat both the baby's mouth and the mother's breast and nipples. And they would go on tablets and on special ointment, and also that's the mother, and the baby would go on special treatment for the mouth, regardless whether they had any signs of thrush. Because if you see thrush in a baby's mouth, you see a really thick cream cheese coating on their tongue that you can't wipe off, and often even around the lips, inside the cheeks, there is white patches. So the news is we do not have to treat the baby if the baby does have no symptoms. And babies can also get nappy rash, and sometimes that could be thrush as well. So as said, it happens most likely after antibiotic treatment. So we have to go back and discuss the most common reason for nipple pain. And that's not to say straight away, oh, that must be thrush. So the first thing will always be a shallow latch, and that's why you should be seen by a lactation consultant who can observe you feed and find out whether it is actually a shallow latch that must cause you the nipple pain, because the symptoms can be quite the same. It can also be something like vasospasm. Now, tonight I won't have time to talk to you about vasospasm, but I will in some of our future sessions. And it could most likely be a skin condition, and that is either eczema, psoriasis, or a dermatitis. So irritations of nipple and areola can be triggered by nipple creams. And the interesting thing also is that most women who breastfeed are told to use purified lanolin. We have been using that for years and for decades. Purified lanolin, little tube, put it on your nipples and it's moisturizing and it's, really good. However, it actually triggers irritations of the nipple areola, and quite often it could also cause an allergy. So thrush can be caused by creams, or let's say dermatitis can actually be caused by thrush creams. And there could also be reasons such as breast pads, because if they're rubbing on your skin, that could irritate the skin. And moisture and breast pads that you may not change regularly could be a cause. They could be a cause because they could irritate your nipples from frequent pumping or from not having the right size. And then one of the other things that is often mentioned are these silverettes or silver cups, because the nipple is constantly in some moisture, and that could cause irritation as well. So if we are now talking more likely about dermatitis or eczema of the nipple that causes the burning sensation, the stinging, and also the flaky skin, then the treatment of choice includes steroid creams, and they can be used during breastfeeding. You may have to wipe them off with a little bit of warm water before you feed, but sometimes when you put them on after you have breastfed your baby, by the time you breastfeed again, it's already all been absorbed. The other side of thrush is that it may not be a candida infection at all, but a bacterial infection of the nipple that causes the same symptoms. One thing that is important to know is that thrush is not contagious. So what that means is that if your baby has thrush treatment, thrush in the mouth, mothers do not need treatment. So I've mentioned beforehand that if the mother has symptoms and is treated for thrush and the baby doesn't have any symptoms, it the baby doesn't have to be treated. So that has changed, and vice versa. Pump parts, infant toys like little chewy toys, towels do not need to be sterilized as we were taught for many, many years. And in fact, harsh detergents could worsen allergy and eczema symptoms. So we don't need to do that. The interesting thing is that despite the fact that this is now fairly new, hot off the press, these new guidelines that haven't been adopted by every country yet and every health institution. A lot of mothers say that they have actually improved with this thrush treatment, that their nipple pain has improved. But what this is supposed to be down to is temporary improvement of the antifungal treatment, what is this called, anti-thrush treatment, is related to the anti-inflammatory effect, because there is things in those creams or medication that is anti-inflammatory. And so that could cause that kind of improvement. Now, last but least, there is no one-size-fits-all pathway to treating thrush in nipples and also thrush in babies' mouths. So to work through breast pain, we need to take a thorough history. We need to see a breastfeed. We cannot just go to the chemist and say, I've got nipple pain and I've been looking at the internet and it says that it is nipple thrush, and then the pharmacist gives you the correct cream and you may find that it's improving temporarily. But if it is the shallow latch and nobody can improve that, then you will start having similar symptoms very quickly again. So we need this individualized care approach to nipple pain. And I think that's all for tonight. As I said to you, I've got to catch a train. And so I hope that you find this information interesting. So I do say that for some of you who may have gone through that kind of treatment, it may be a little bit confronting for you to realize that you may not have received the right treatment. And so, as I said, it is new and it will take a little while until everything changes. But at least you have got an idea to question any treatment for thrush by your practitioner, your GP, your midwife, or your other healthcare practitioners who are treating you for any breastfeeding issues that are causing breast pain and nipple pain. So on that note, I will say goodnight for tonight, and I'll see you in another week. Thanks for watching this, and have a really good night. Okay, I'm going to press now the end of the stream button. Bye for now. It's not doing it, is it? Okay, bye.